So once again, I would like to welcome you all to Developing Long-Term Partnerships Programming for K-12 and college students, part of our Region 7 Presents series. Today is Monday, November 17th, 2025, and one of the ways that NNLM supports health information access is through funding. NNLM Region 7 has been pleased to partner with the Connecticut chapter of the National Association of Hispanic Nurses on health information outreach awards over the past several years, as well as Southern Connecticut State University. Today, we will hear about 3 projects which highlight health literacy and healthcare workforce development. Again, our presenters for today are Dr. Maria Kroll and Dr. Marianne Perez Brescia, and I will hand it over to you, but I need just a second um, to find the slides. Okay, I think we're ready to go.
Great. Thank you, Benny, for the introductions. Good morning, everyone, and I'm glad to be here, and I hope you're having a good morning so far. My name is Marianne Perez Brescia, as Benny mentioned, and I'll start our presentation this morning to discuss how our National Association of Hispanic Nurses Connecticut chapter developed long-term partnerships in our community. Next slide, Benny, if you wouldn't mind. So I'd like to start off by stating that establishing community partnerships is a key component for building engagement with youth. As a chapter, our experience has helped us recognize that collaborating with schools, families, and local agencies expands access to resources. It helps build trusted relationships with these partners, and it also increases our insight that is needed to reach youth early on. And these collaborations also create pathways for underrepresented youth into education and careers by connecting students with real world experiences. It also connects them to mentors and supportive networks that really strengthen learning, development, and long-term workforce diversity. And that's really our goal. This is essential to sustain their interests and create supportive pathways for future success. Through the community collaborations that our chapter developed, we've been able to gain a great deal of insight. So, for example, while many organizations focus on getting students into healthcare careers, they usually target high school students. And the research points that starting kids off in elementary school has really prompted our shift in our approach as a chapter. We had several programs that required different partners in the community, from elementary school to college and community organizations that we're going to share with you today in this presentation. And Maria, I'll have you discuss the next slide.
Good morning, everyone, and thank you for joining us this morning. We're very proud of the programs that we elected to hold. So I'd like to tell you one of the decision to hold these programs is because the motto of our chapter, our national association, is to improve the health of the community, especially the Hispanic community. So we focus on education and the future of nursing as a profession. For every grant that we received, and we received numerous, so we are very grateful to the National Library of Medicine, Region 7, because it allowed us to develop different workshops for our purposes. So the health literacy with that adolescent program, we knew it was important to develop something, and this grant we received around right before COVID. Initially, we were supposed to be in person and we had to shift to online, which required us to then move on to figure out how are we going to address adolescents when we're all in virtual settings. And so one of the important things we did is we connected with the HOSA programs around the state of Connecticut. And so we reached out to them. We asked them to told them about our program, and then we went ahead and developed it. So it was all intended the health literacy was because the students are at an age where they really need to learn about their well-being. They really need, there is an onslaught of stuff online that really is not always true. And a lot of these students that we went to educate are students who are from immigrant populations. And then so they accompany their parents and help them, they can help them not only navigate the language, but also navigate the technology. When we thought about doing the dive-in, we focused on engaging current nurses to talk to our students about their jobs. And the focus especially was to, because these were going to be elementary school children, we wanted not to bog them down with what nursing school looked like, but the importance of the topics that really they needed to concentrate. So the sciences and the math, how important that was. And um, every workshop that we had with these students, we focused on that. And we targeted a younger group because they were in a position to start making changes in order to think about a career in healthcare, especially nurses. And when we developed the workshops, we really thought like what could keep these students engaged because you lose students in the first 5 minutes of you just talking, so they have to be doing stuff. And that, when you're an active, you have activities, students seem to engage more. We had um, a grant called the MMRS, and this grant was a collaboration with Southern Connecticut State University. We wanted to address success and resilience, and also college students are in a position to make better educated decisions for their health. But sometimes, as with the adolescents, the onslaught of bad information online sometimes can get them in trouble. These students really who participated had an opportunity to learn about health literacy, the products available, and also then to go out into the campus community and teach students about the importance of health literacy and looking up topics that were really true and not going to websites that really weren't going to be helpful for them. The group that participated in this were able to receive tutoring, and then these were nursing students. So then at the end, they each had an opportunity to attend an NCLEX review class for free. One of the things that they did is they partnered with sororities, and until this day students pay it forward because we have Southern has a summer nursing symposium for high school students, and these students come back every year and do a whole health literacy workshop with the students who are the high school students who are participating in the summer nursing symposium. Next.
All right, so I know Maria already mentioned some of the programs, but these are the three programs we initiated with the help from funding that we received from the network of the National Library of Medicine, and we'll just go into a little bit more detail. So the next slide. Thanks. So the health literacy program was the first funded opportunity that we had with the network of the National Library of Medicine. Boy, that's a mouthful to say the whole title. Just to give you a little bit of background, so according to the Centers of Disease and Prevention, 1/3 of people living in the U.S. have low health literacy, which results in overuse, underuse, and misuse of healthcare services. They also experience greater mortality risk and higher health costs. As we know, health information and health service delivery is really shifting toward a more digital type of method, and we've all experienced, I'm sure, the use of MyChart or making appointments online, or even your visits converting over to telehealth, just to name a few. And people with health literacy challenges, they have a higher risk for poor health outcomes with this digital shift. While our chapter's primary goal was to educate adolescents to increase their ability to make informed healthcare decisions, we also had hoped to empower the high school students so they felt equipped to assist their family and friends in finding reliable health information online. And as mentioned, adolescents of immigrant families or adolescents whose families have English as a second language oftentimes accompany their family members to healthcare visits. And this generation now is being raised in an era of technology, so leveraging their power with accurate health information sites and teaching them how to determine good, reliable sources is really a win-win opportunity. But unfortunately, again, due to the COVID-19 pandemic, our intended in-person workshops were provided online through Zoom. And members of our chapter created and delivered a 1 hour virtual workshop to introduce students to credible sources online for health information and provide them with methods to also evaluate these websites for their reliability. Our community partners consisted of 4 high schools that were located in historically underfunded school districts and 1 community center. We had a total of 18 online workshops, and it was delivered to almost 200 adolescents. Our program evaluations, they had revealed that 100% of the students that participated learned new ways to find health information. 97% of the students identified methods to seek reliable health information. And then 85% of the students who participated felt that they could teach others something valuable from this workshop. So, those findings, I would say that we really exceeded our goals. And again, even though we were faced with some barriers in our implementation, and we were really not able to provide any in-person lessons due to the pandemic, this presentation came in a timely manner. We were able to provide these adolescents with reliable sources to look up some health information for themselves and their families and their friends during the pandemic. And I'm sure we can all attest to how much misinformation was out there during that time. So this is knowledge that can continue to be used every day in real life situations, even today, even after the pandemic, using these particular reliable sources. At the end of our program, when students were asked about other topics of interest for future webinars, many responded that they were interested in mental health topics and in learning more about the nursing profession. So this is our perfect segue for our next collaboration. Maria?
Thank you. So the dive-in program was developed as a result of the feedback we got from the students and also because of what we know about nursing. You know, we are facing a shortage. There are times where students are not interested, or when you ask the younger population, what do they know about what a nurse does? Very few can tell you. So we wanted to focus on how do we introduce nursing into for this population. So we developed a collaboration. In order to do this, we initially had intended to offer this during the summer for a summer camp for a long week program that would allow us plenty of time to introduce, because you know, as nurses, we always dream big about what we can offer during a session. And so we had all these bells and whistles that we were going to do, but there was a delay in getting the grant started, so we had to pivot to starting it in September. So we moved from our initial partner had been the Lighthouse Foundation in Bridgeport, Connecticut, which provides after-school programs for children, and they provide a summer camp for children in the city of Bridgeport. So we had met we had developed this program, and that was our partner. And we had partnered with them on previous occasions to provide, you know, health fairs and healthy eating workshops to students. And so they were very happy to have us back. Unfortunately, we couldn't do it over the summer, so we pivoted to providing it to a multicultural magnet school in the city of Bridgeport. We had a contact there that we reached out to the principal, we met with them, we outlined our program, and we decided that the fifth grade class would be the most receptive class, and then what happened is the principal reached out to his teachers and he recruited two very interested teachers for the fall semester, and then two interested teachers for the spring semester. So from September to December, we did our program for two sets of students, and then in the spring semester, we also in and that I mean January to May. I always say spring because I'm at the college setting, but people think we waited till March, but we didn't. We started in January. So what we did is once we had we had established our connection with the schools and where we were going to offer it. They had given us very generously 45 minutes for each student group. So we would go in one morning, once a week, we would go into one class. When we were done with that class, we would go into the next class. Then after establishing this partnership, now we needed to figure out how do we engage because we wanted to bring in nurses from these specialties. We decided on providing a specialty around the operating room, public health nursing, pediatric nursing, maternity, and also emergency room nursing. So we needed nurses from those disciplines to come to the school and do it. I want to go retract that. In the fall, we ended up doing an after school program instead of the class. In the spring, we did the class. In the fall, we went after school. And so once a week, we came to their program and we were allowed an hour to meet with the students and teach them about the topics that we had outlined. So we were able to recruit nurses that came in and talked about their profession, how they got there, what made them decide, what they do in a day. So, for instance, for the operating room nurse visit, we brought the game operation. We taught the students how to dress in sterile garments, and then they proceeded to play the operation game and try to stay, and try to stay sterile and use all the techniques that we had taught them. For maternity, we had small babies, we had measuring tape, we had a scale, we brought in things and we talked about, and everything that we related to science. For instance, during the game, we talked about germs, we talked about hand washing, all these things that are required in order to be to be in these places, but we also related it to the science. For maternity, the same thing. We related it to math and science. So weighing the baby, how much does it weigh? Having to know what pounds and ounces and what inches were. And so the students were really engaged. And then, the biggest, what they enjoy the most is like learning how to swaddle the babies. For pediatrics, we did a lot on pediatric safety, helmets, all these things, how to stay healthy. And then for public health nursing, or emergency room nursing, we brought in an emergency room nurse who went through very low level stop the bleed, friends and family CPR, like what to do in cases of emergency, and talked about her job. So the students were really engaged in doing the activities and in listening to the nurses. Um, we did this in the fall, and then we did this in the winter and spring time, and students really loved it. Um, they enjoy listening to the nurses, and then they enjoy also, and we did surveys asking the students what they enjoy the most, what they wanted to see more of, and they really enjoyed everything. For public health, we tied it to adult care, and we related it to family members who were of a certain age, older age, and other things that they could experience. So, for instance, we had the students wear goggles with Vaselines on, Vaseline over the glass, and we put gloves on, and we then had them try to pick their pills from a bottle. They were like M&Ms, and they had to go in and pick all the red ones. And so they really had an understanding what older people experience. We also had them wear the glasses, wear the gloves, and then we decided that we needed to make a shopping list and they needed to write down the things that they needed to get. And then another activity we did that they really enjoyed is we had them stand back to back and then talk and see if they could hear each other. So these activities really were engaging. The teachers in the schools were really very superly engaged with us, and they really look forward to us coming every week to provide this opportunity. This opportunity led to us providing going to a second grade class a year later in here in the city of New Haven. And we brought in the same thing. We did the OB with the weights and weighing the baby, measuring the baby, and writing down the numbers only because we wanted to also relate it to what they were learning. That we went to a time during the time where they were learning about math. And so we wanted to see how important these topics were and how important it was for them to continue to do well so that they can continue on to high school and college and become nurses. Um, I think that's it. Moving on. Now, this grant was a collaboration between Connecticut Non and Southern in that chapter members were able to provide the education. So all the chapter members who have participated in the health literacy campaign in the first uh, grant that we received came back to train these students. So we took the model for this. So I'll tell you the MMARS stands for Minority Mentoring for Academic Resilience and Success. So mentoring, our objective was for students to be paired off with a student mentor and a faculty mentor. We wanted to utilize uh, uh, a mentorship program that had been developed by one of our own students. For academic success, we wanted to provide the students who were at risk with extra help in terms of their courses. So we provided tutoring and support to them. For resilience, we wanted to identify the need and conduct workshops to help meet the individual needs. So we did a survey, sent it out to the students, asking them what is it that they really wanted to hear about in order to build their resilience. And then for success, we encourage the students to develop an academic success plan. We wanted to engage the students in the program of study early on so that they would be successful. For the part of the grant that had to do with health literacy was that this once we recruited the students, we developed a train the trainer, train the yeah, train the trainer. No, I think. And so the students were trained and then they each had to, we had 5 students that we recruited. And those students then went out to the campus community here at Southern and engaged sororities, teams, clubs, and they each had to engage four of these groups and then go into their groups and teach about health literacy. One of the things that they did, once they did this, then they came to the summer symposium. And as you can see on the slides, this is what they worked with high school students to identify topics that the high school students were passionate about or they felt their family member needed to learn about. And so then they developed each student, we formed groups, and each student was assigned a group of high school students, and they worked for an entire week identifying the topic, researching it, making a presentation, and then at the final day when we invited parents to join, parents and families to join, each student made a presentation on the topic that they had researched using the Library of Medicine's tools. So overall, students really in this, they really we also surveyed the students about what they needed to do, and they felt that, or how they felt this had helped them, and they really enjoyed being able to learn about something. They felt confident confident enough to go out into the campus community and teach other students. And the reason we chose college students is because so much they're at a point where they can, a point in their lives of an age where they start to attend appointments on their own. They're in a community where parents aren't around. And so they really need to learn how to make better health decisions. And we thought that this was really an important topic for them to do. One of the things that we continue to do, as I mentioned early on, is we continue to use these students that were trained to come back every summer and work with high school students and do a presentation. So every summer we have them work on them, then we have a presentation, we make a poster, and then we present the post. And each student group stands around their poster and presents it to their family members. So how we collaborated with Southern is because I teach at Southern, and I'm very passionate about mentoring students. So we thought that this was really a very good uh, partnership to partner with Southern and partner both Connecticut and Southern to partner together in order to provide this education. It allowed members of the chapter to engage with college students where maybe they didn't have that opportunity because they have different jobs that they hold. And so this allowed them to also then mentor the students for success. And students had a lot of questions of the chapter members who are participating in terms of how did you get to where you are? What do they need to do? And one of the things that we always emphasize is, doing well in sciences, especially if students are in their prereqs and as well as reaching out and creating mentorship opportunities with other members of their network so that they can be successful. Okay. So,
Go ahead.
no, you start off.
All right, so I was just going to say some of the positive and negative findings of the health literacy program that we initiated. So the high school students really appreciated, this is the positive, they really appreciated the relatable information. Most high school students don't necessarily talk openly. They keep things to themselves or amongst their own little peer groups. So they were able to access health information online with the resources that we provided on their own. And most have cell phones, so they're able to do this in their own, privacy of their homes. So they really appreciated that this was relatable information that they can use. They also liked the hands-on, even though we weren't in person and we didn't do a hands-on activity in the sense of the other programs. They had the ability during their learning session, their webinar, to access the information and do some real-time learning. So they were able to go on their phones and look up information and at the time of the presentations. The negative, unfortunately, is the overall short time that we had for these opportunities, the 1 hour session, and then, the limited follow-up to just go back and look to see if students were actually utilizing this a year later or 2 years later. But one other positive thing that did come out from our health literacy program is that this is a program that can be repeated in many populations. So although our focus today is K through 12 or K through college, we're able to take this health literacy program and go into senior centers or other community organizations. So that just expands our community collaborations and partners. So those were some positive and negatives that we found from the health literacy.
In terms of the dive-in, the number one, when we asked them did you enjoy the program? Do you want to see more? Even before we did our survey and we said, oh, we want to thank everybody, we thank the students for their attention. And so the students were really wanting us to come back. They wanted us to come back every week. They didn't want to see us go. They thought that there was more that they could learn. I think that the teachers were really also felt that the program had been so valuable that they would have loved us to continue coming back. Um, in terms of some of the drawback is the time. We were only allotted 45 minutes tops an hour in the after school to do these programs with the students. And as I mentioned early on, we had, put in so much that we wanted to offer each session that it didn't work out. We were able to, I think, have a great program in that students really loved it and wanted to continue doing it. But at the same time, it could have been, I think an hour and a half would have probably been a little bit better. One of the things that developing this partnership with them, has worked. We, haven't returned to the school to do more, but that's in the plans to do this. One of the things that we have done because Connecticut Non collaborates with Southern on a lot of things is that we developed, Southern was able to develop because of this, the a partnership with New Haven Public Schools where we went in and we did for eighth graders we introduced healthcare careers. So for 6 weeks, we went in once a week, and one of the weeks we did nursing. So we used the framework that we use for the dive-in program in order to continue our work doing the second graders, doing the eighth graders in New Haven Public School, and I think that we will continue to offer this program to local elementary schools in order to, introduce a topic of nursing and the topic of doing well and preparing yourself for college. As far as the MMRC, or sorry, the mentorship program, it really went well. Students were really, as I mentioned early on, were really engaged in doing this. And as a result, we have been able to continue offering this health literacy workshop and having the students mentor high school students by coming to the Summer Nursing Symposium and providing them with this education. So this has been going on now for the last 5 years, and we continue to offer the program every year. So we have a Summer Nursing Symposium coming up. The chapter itself is working on reestablishing some connections that we made to go back and because we believe in that this topic is really important, especially, because we are committed to helping, improving the health of the Hispanic community, and we want to make sure that they're aware of the things. So many, as Miriam mentioned, so many people are unaware of what websites are safe and what websites really are very bad for them to access. But I think that that's it, and we have enjoyed having these connections and these grants and being able to provide the the education to the community. We didn't mention that we have presented at the National Association of Hispanic Nurses National Conference. We presented the topic of health literacy with adolescents. We presented the topic of the dive-in program, which I didn't mention, is called Developing Inclusive Voices in Nursing. We presented this also at the National Association of Hispanic Nurses conference in Portland. The first one we went to Puerto Rico and presented a few years ago. In 2023, we presented Dive In Portland, or 2024. I'm confused. And then we did a poster presentation for the Dive-In at a different conference. And then for the health literacy, we did a Sigma Theta Tau conference, Region 15 conference, where we presented the topic on health literacy. So we have been, talking about this and continue to do the work. I think I'm done.
Thank you so much. I just need 1 second to um, uh, Thank you so much, Dr. Perez Brescia, Dr. Kroll. These are amazing projects, and Connecticut Non has just been such an excellent partner over the years with the NNLM, and we've been thrilled with the projects and success of the projects that you have developed and implemented over the past several years. And just as you're hearing, such a creative and thoughtful and engaging programs. And it's especially, gratifying to also hear the long-term outcomes of the work that you've done, how you've been able to take it to other settings, how you've been able to present to others so that they can hear about your great work, which you're also doing today. So we are so grateful for that. We do have a few minutes for questions and answers. So if people would like to put any questions in the chat, I don't know, there may already be some things there. Um, I
No, we don't have any questions yet.
Okay. I was I really appreciated you talked quite a bit about the idea of students learning the information for themselves, but learning it well enough to be able to teach other people. And that kind of was a theme across all of the different projects where they could either share it with their families or share with other students or train the trainer models. Um, is there anything else that you would want to share about that model of working with youth?
I can just take a jab at it. I look at healthcare, and healthcare, we say if someone has self-efficacy, if they're confident that they could participate and they are skilled enough to do some, lifestyle change or health habit, that they will be more committed to doing it, right? So our goal as a nurse is to always educate patients so that they can master a skill, such as, for example, if you have been diagnosed with diabetes, how to take your blood sugar, how to give your injection. When someone feels really good about what they're doing, they tend to do it more. So, one of our goals is when we educate young students, because we always want to pay it forward, right? That's what our whole chapter is all about, is paying it forward. So when we educate the students, if we give them the tools and the confidence to be able to do this and bring it to wherever they're going in their own environment, that's really, that's kind of keeping it, paying it forward. So it's really just developing that confidence in the students so that they can continue, doing whatever we're focusing in at the moment for the topic of interest.
Hey, Benny, I have a question to follow up on that. When you told the students about what nurses do, education comes to my mind, but do you think they would be surprised to hear that nurses educate as?
I mean, I think that one of the things that I think even nurses are surprised sometimes to hear that they're really educators all the time. So yeah, we're really, when we talked about it, they never see the nurse in the educator role. I think that they think that it's like some separate person. So we always talked about like not only what they can do initially in their career and as they move up, where to become, but we always talk about nurses as being educators in terms of health promotion for their families and for
Mhm.
other students. One of the things I wanted to mention is that early on when we started our first grants, and we were looking to partner not only with high school students, high schools to provide this information, I had reached out to Yale has a health engagement collaborative. And so I reached out to them saying, we have this program. We'd like to find out if you can refer us to any, community partners that you have that may cater to adolescents. And so I provided them with our information, and then they invited us to provide because they said to us, and this was, I want to say in 2021 or 22, they said, "Oh, we're in the process of developing or doing a survey around um, the class standards, and we want to have you come and talk to our partners." And so between Marianne, myself, and Dr. Planas back then, we, talked to different collaboratives. So the Fairfield County Collaborative, the New Haven Collaborative, the, Hartford Area Collaborative, and there was partners in their community who were listening to us talk about how to find health reliable information and how to teach their communities, their so these were people for directors of, for instance, uh, a community center in the city of Bridgeport. So then they would turn around and teach their people how to do this. And so we engaged beyond the high schools. We engaged with a lot of community partners to offer this education in terms of health literacy. And I think that it I think it has been really for us really empowering to be able to do this and for to empower students also. I think family members when we did a class at the Spanish community of Wallingford for their adolescent groups and their parents were permitted to attend. It was virtual. And it was really great because so many parents had so many questions about it. And, high school students learn and then they could turn around and teach their parents.
That's great. Thank you.
Yes, so I was thinking about the confidence aspects too, and just the students were learning about their own well-being and then developing confidence in how to evaluate resources, how to find health information, what to look for, how to evaluate, and then how to share. Um, yeah, and I just appreciated just helping. One of you said helping understand the importance of finding um, accurate health information and then being able to evaluate those health information resources. And I just really enjoyed hearing about all of the really engaging activities that you've done throughout the process, but also today, hearing the ways that you've engaged students. And it's just so incredible, like all the different types of techniques that you have utilized over the years to engage different ages and bringing it to the second grade. That just like warmed my heart to hear about going to help second graders understand how math is going to impact them long term. So it's not really a question, but feel free to.
I think no, Marianne, I feel like it really is. Every time we select a group, we think about how do we keep them engaged, and because we are, and I'm not sure how many people are in education, but you know how you really, if you don't engage them from the get-go, you lose them and then you might as well just be talking to yourself. So we always think like this is a group, like with the fifth graders, we knew that we needed to have activities that they could relate to what we were saying, that we couldn't just be standing there. And even when we brought in our guests, they were the ones that, when we were doing operation, they're the ones that taught them how to put on the sterile gloves, how to put on the sterile gown, how to cover their hair, all these things. They're the ones that taught it as they were talking about their activities during a work day. Like what is it that they do in the operating room? And then the students, of course, love playing operations. So that was really great. When we did the emergency room nursing and we had little, mannequins to help them with doing CPR or stop the bleed. It was always like at their level and not too, um, scary or anything. So we, because when you're dealing with fifth graders who then go home or fourth graders who then go home and tell the story, we wanted to make sure that they were able to tell the story in a way that it related to what we were doing and not have parents knocking on our door about scaring their child, but so we didn't know. Marianne, any idea?
No, I think you mentioned, it really needs to be relatable, right? And it needs to be age appropriate. For our high school students, usually they go to bed and wake up in the morning with their phone attached to their hand. So what better source of, access to health information from right in your fingertips, utilizing this phone. And with the kids, one thing I noticed in kids who are possibly interested in nursing, and when we talk about how important those STEM courses are, the science, the math, And they wonder, well, why is math important? And then you give them an example. Well, let's add some numbers, regarding a situation like how much fluid somebody's taking in, how much fluid they're drinking, and then you give them a real life situation and they can connect the dots. So it's really connecting with the population, no matter what population, whether it's a second grader or if it's a senior citizen. What is happening in their life at that moment that you can connect to and take what you're trying to educate and make it relatable. So, I mean, I think Maria had mentioned pretty much in a lot of the explanations in the programs how we brought that to fruition. And
And one of the things that we did is that while we are focusing on our chapter focuses on improving the health of the Hispanic community, we did branch out and also to different groups. So we adjusted to whatever group that we were invited to speak to talk about the things that affect that certain group and how important it was. No, in some groups, children play a high an important role in translating and helping parents understand technology, depending on the age group. Also, if you have older parents, maybe they aren't quite computer savvy or tech savvy or phone savvy. And so I think that we adjusted according to the age, according to the population we were dealing with, and all the programs are really tailor in a way that we could easily shift focus if we needed to, address certain needs of the population. Um, for instance, with the introducing nursing to second graders and then fourth and fifth graders and then eighth graders, we needed to do different activities because we couldn't talk to an eighth grader the same way we talked to a fifth grader or a fourth grader. That wasn't going to fly. So I think that one of the things that we do well as a group is that we really identify what the needs of each individual who invites us is so that we can provide a program that's worth their while.
I was actually gonna, so that question in the chat is actually related to what you just ended with. One thing is before we start our collaboration, we always find out what the need of the community or the ask is of that particular community. So we always let them drive what the purpose is and what the goal is, and then we come in, with what we're bringing. So, and in regards to feedback, we always do surveys, but we start off with the feedback from the community of what it is that their ask is and what their needs are. And then, there's a dialogue throughout the whole entire planning from the beginning of asking what it is that they want, during, and then afterwards as well. So that's how we continue to get the input of the community. And then when we do have the opportunity, and when we have these long-term collaborations, when we go back, for example, our high school students, when they said, they want to have more topics on mental health, we go back and we discuss, what are our future opportunities with our chapter to reach the same population so we can continue the collaboration and continue the dialogue. I'm not sure if that answers your question, Maureen. I'm not sure, Maria, if you have anything to add to Maureen's question.
And it just doesn't translate to what are the things in terms of the topics, but also in terms of how does it fit? Like, do they want us to come in the summer? Do they want us to come in? We offer opportunities after school, in evening, join them during the day, for a regular, like with the health engagement out of Yale, like we met their needs. No, we didn't say, sorry, we can only see you at 7 p.m. on Tuesday. We are like, okay, when do you meet? Because we're really passionate about sharing what the information, but also what the chapter is doing. So we want to make sure that we're meeting the needs of whoever's asking us.
That's great. And thank you so much for sharing more about like the process from the very beginning. So I do for those there is an evaluation link, so we'll go ahead and drop that in the chat for people that are going to be looking for that for the continuing education. And also, Margot is going to put in a link to the Region 7 newsletter. So if people are interested in hearing more about what we're doing in classes that are coming up, you'll have those. But we do have I think like 2 more minutes for if there are any last questions for our speakers. Um, and I don't want to take your chance, but I will ask one if I don't see one soon. But um, so I just, again, am so thankful for the opportunity to work with you, to hear more about the projects, and to hear all the ongoing work that's happening. Is there one last thing you wish everyone knew about, whether it's a resource or part of the process or an encouragement? Is there anything you would want to share with the group?
I mean, I think that whatever idea you have, I think that for to educate the community to help them have better lives, people are willing to collaborate with you. So no, do not let it hold you back. There is somebody out there who wants to hear it, who wants to bring it to their organization. And especially, when we talk about children and adolescents and college age students, they're really eager. People who work with that population are really eager to hear from you and help you develop something that would work for them. So I say go for it. One of the things about our chapter is that when we invite members, I always ask members, what is it that you wish that you could do that you haven't had the support to do? And so then we engage as a chapter to help develop whatever, because people have great ideas, but unless they have support, they can't really develop them. So then develop it. So we do that. I always say, so reach out. People want to hear what people want you to come to their communities and help them educate, especially, because there's not a cost attached to it for people attending and they gain something from it.
That's an amazing invitation. Yeah, thank you.
If I can just add to, just working in healthcare for 30 plus years, we've always talked or um, lectured our patients, right? And what we know now is that communities know what they need and what they want, and they just need sometimes guidance, assistance, or resources. So, always making sure with community collaborations to understand that we're there to meet their needs and we're there to hear what it is that they want and to empower them. And it's a collaboration, not us coming in as, we are the all knowing and we are here to tell you what you need to do to make your community better. They know what they need many times, and we should be listening a little bit better as we want to build this trust and collaboration. And everything we bring will be welcomed and people will engage if we have that sensitive type of approach and respectful approach, and also allowing them to master it to their level so that they could feel confident in, once again, kind of repeating and paying it forward. So I think it's just really important that we go into these communities with a very open mind of what it is their needs are, listening first and then developing.
That's a perfect way to end today. So thank you both so much again. And we will post the recording and we'll let everyone know. And again, thank you so much.
Thank you for the opportunity.